Seizure. You'll hear more about that from Dr. Baltz in the next talk. I get to speak to you about bleeding and nail surgery a little later on. And then chemical matrixectomy, 1, 2, 3, is the fourth procedure that I think is really valuable in starting out with. You'll hear more about that from Nilton Di Chiacchio. But just to say, this patient is a cancer patient on an EGFR inhibitor, had a very painful nail for a very long time. In addition to dealing with cancer, just walking was difficult. Did a chemical matrixectomy, and within 2 days his pain was better. And this is what the wound looked like at the 2-week mark. This is a 20-year-old with a band of longitudinal melanonychia. Knowing how to get to the matrix and do a proper excision is crucial. You'll hear more about that from Dr. Jelinek and Professor Richer momentarily. But at 20 years old, she had a melanoma in situ. Dressing skills. It sounds maybe basic, but it's not always easy to do dressings after nail surgery, and it's worth learning how to do it. That would be the 6th skill, I would say. And again, everything that you're about to see will be given to you, but kind of as a summary on how to learn, get that knowledge base in medical and surgical nail skills. Lots of conferences. We just heard about Dr. Baltz's hands-on surgery workshop, which is a great learning environment. Professor Richer's oncology course in Brussels, going into its 20th year. Of course, a wealth of information on the internet for articles. Online learning is provided also by the CND and ENS. And the textbooks that I use are these. There's more out there. You will have links to all of these, and actually there's updates to 2 of these coming imminently. And if you really get into it, you may find yourself having dinner one night before you do an exostosis for maybe the 2nd time. So that's that. By way of summary, what can you do Monday morning? Choose your people. Is it going to be adults, kids, or both? Decide on your framework. Is it dedicated or integrated? How many half days a week? Invest in some tools to simplify your life, like infographics, templates. Invest in tools, the mechanical tools, not very expensive. Forge relationships, especially pathology first and mycology. And then see patients. Build your knowledge base. It'll grow quickly. Nails are a distinct, very, I think, manageable, but underused and undertaught area of dermatology where you can make a significant